Thank you guys for all coming on for this great little event that we put on now. It's been going on a few years. Dan and Steve really do a lot of good work getting you guys a lot of the biggest and best carriers that we have in the ACA marketplace kind of in front of you guys. So super excited to be here. Again, thank you, Dan, for that. And hopefully you don't get hit too hard, but I mean, it looks like you're going to get hit hard. I mean, it looks like it's going to happen, but we've also seen those things turn, last second. So praying for you. For any of you on this call that are in Florida, and if you get hit hard, I still expect to see you in attendance tomorrow, just on a little raft somewhere. Yeah, there's Wi-Fi. I think Elon's got you guys with some Starlink or something. No, I'm just kidding. But seriously, wishing everybody the best out there. I know it's going to be a little bit crazy, but so maybe you guys only get today, and so let's make today memorable. All right. There is a question here in the chat. Are commissions increasing for 2025? Will agents be getting carrier bonus paid out to agents, all that stuff? So that's what we're going to find out over the next 3 days, right? So the carriers are going to be coming in here and wooing you guys. They're going to tell you what's changing for 2025, why you should sell them in 2025, and all that good stuff. So that will be something, I promise you, that is getting covered here by some of the carriers. As again, they're in here to get you guys to sell them this open enrollment, right? That's what this is all about. So, and yeah, this will absolutely be recorded for all you Florida peeps that are going to be on a sailboat with Dan. Brianna, appreciate it. All right, so let's jump into here, guys. So the opportunity, where are we right now in this ACA marketplace, right? And just understanding it, because depending on who you are as an agent, who your uplines are, what agencies you work for, right? Some people, we've been fighting ACA for years, right? There's some people out here who have been fighting ACA for how many years now? And the reality is there's no more fighting it, guys. ACA is here and it's here to stay, right? And so you got to make sure that this is something that we are selling. It's in our tool belt, and make sure that we're doing appropriate sales in that marketplace, okay? So with that, the first thing is understanding the opportunity, right? This has been the graph that we have seen of growth in Obamacare enrollments since this thing kicked off. It's been a decade now, right? So as you can see, now, one thing to point, the last 4 years here has been a pretty significant jump, obviously, with the current party in office. So trajectory shows it's going to continue that way, but just understand this is where we're at in the marketplace right now, is almost 25 million enrollments every year. And so guys, that's where the business is going, right? It's understand whether you're selling it or not, people are buying it. And so you got to make sure that this is just something that we offer, that this is something that's in our tool belt, like I said earlier, okay? If we want to look for more opportunity in this market, right? Here's some states where we've really been seeing a big push. Now, some of this as well, like if we want to take it political, you can tell that these are a lot of the more conservative states. Maybe a lot of this is because they were later to the party, where they were more in the private market of health insurance until kind of everything was forced on. So I do think some of that is that change that you're seeing in there. But as you can see, a lot of these states are seeing double, triple the amount of enrollments that are coming in for Obamacare. And so, guys, ride the wave, right? Understand this is what people are looking for health insurance now. And so embrace it. The commissions are pretty solid now. They're a lot better than they were 10 years ago. Let's call it that, right? And now it's about really kind of bringing it together and building the best packages for our clients within this Obamacare world that we're in, right? With this ACA world that we're in. And so speaking of the packages, guys, this is super important stuff. And so we need to open with this, okay? There's a big survey, Def's IFP shopping survey, that was done just recently, actually. Really cool survey here. You're going to see, did agents discuss other types of insurance? Guys, under half of the time, 49% is yes. Under half of the time, agents actually discussed a secondary or supplemental type of insurance. meaning more than half of the agents out there helping with Obamacare, fielding insurance calls are literally yes men and yes women, right? Just taking a call, saying, what do you need? Here's the application. I'll help you with that. Check out, right? I don't think that's what most of us got our insurance licenses for, if I'm being completely honest with you. Okay. People can go shop for health insurance all on their own. They can buy this Obamacare stuff all on their own. Why are they talking to you, right? And the reason they're talking to you is to help them understand this insurance stuff that they're buying, right? Understand this complex health insurance world, make it make sense for them. And guys, when you help it make sense to them, the supplements are just matter of fact, right? Why wouldn't you have this in place to make the holes in your health plan be protected, right? But my favorite thing is that huge orange box on the right side there, right? 67% of clients whose agents discussed other types of plans, meaning a different type, a supplemental type of insurance. 67%, two-thirds, indicated that they enrolled in an additional policy or policies. Guys, the stats are there. The problem's you guys. And maybe not all of you, but the problem is us as insurance agents, right? The stats show it. If you offer, they're going to take it two-thirds of the time. So why are we not offering over half of the time? It doesn't make sense to me. Doesn't make sense to me. But guys, this is where we earn our money. So help people understand the Obamacare plan that they're buying. Understand the things like the maximum out of pocket on there and how is that on a family plan versus an individual, right? Understand their deductibles. Where is the exposure? Do they have money in the bank for the plans that they're buying? And the reality is probably not, right? And let's not fight that fact. So if not, how can we make sure that we're adding extra protections in there? So a lot of times it's, hey, let's not go up to that gold plan. Let's stay with this bronze plan that we're on and just use that money that you would have spent going up to a gold plan and maybe use it to add some supplements that are going to really protect you when the oh snap happens on your health insurance, right? So that's what this whole thing's about. But guys, if the stats aren't screaming at you here, just offer, right? Help your customer understand this insurance that they're buying, understand where the gaping holes are. And do you have $9,000 as your deductible if you sneeze wrong this year? Because if not, hey, well, luckily I put an accident plan in place for you here and it's like $30 a month. Okay. Something like that, guys. Help them use their money more wisely. Help them be wiser consumers in the health insurance marketplace. Okay. So that's our job. That's our goal. That is what we are doing as insurance brokers. What I'm going to do for you guys now is show you a little bit of Allstate's quoting platform. So now, some of you on this call, you're like, dude, Nick, I've been in Allstate's quoting platform all day. It's what I do. For you, whatever, it's nice. It's nice having you on here. We'll have a carrier on in about 45 minutes for y'all that'll tell you what's changing with their plans. But the big thing going on here with Allstate and why I'm going to get into the quoting platform for you guys, we have partnered with Health Sherpa. And so if you haven't been in here recently, now you guys can do ACA enrollments in here paired with supplemental enrollments all in the same shopping cart. And what that's allowed us to do at Allstate, that's allowed us to add some discounts when you're pairing some of these plans with Obamacare sales. So really, really cool stuff. And so we'll get into that a little bit and show you what that looks like. So I went ahead and I built a customer out here for us ahead of time. Just a 40-year-old individual. And he's not 40 yet. I don't want to rush him. The system is rushing him because he's turning 40 on January 1st. But that is when this plan effective date is for, because we're going to look at this like Obamacare, like we're looking at the 2025 plans, right? If you want to add a wife and kids, you can just check boxes here. I'm not going to for this example. I'm just going to go quote now and jump right into it. Okay. So depending on what we're quoting, right? Historically, short-term medical's always been the first thing you came into to quote in Allstate, right? And so historically, that's still coded as the first thing that's going to come in here to quote. You can answer the questions or you can move to a different product. Where I want to take your eyes to is this health on exchange. So this is our link up with Health Sherpa here, right? So if you actually check this box to acknowledge that you have the consumer consent, one of those new Obamacare things, answer if they're a smoker, and then what the household size and income is so that we can estimate a subsidy out, okay? What you can do here, let's pick January 1st, right? So let's go to January 1st and show plans. Guys, we are able to run Obamacare quotes right here in the system, in the same application that you're going to be able to run all of these supplements on the left side here, okay? So Marcy asks, what happens if someone buys an ACA health plan and then 6 months later they want to add dental, accident, etc.? Are they still able to get a discount? Marcy, at that, you would call member support or broker support and ask if they would be able to apply that discount, because the system will not automatically do it. No, they all need to be in a shopping cart together for the system to give that discount. But you might be able to call broker support and see if they can add that once they can verify those plans after the fact. Some of those discounts, though, would just be triggered, like a dental and accident will trigger its own discount, but that's a whole different conversation. The Obamacare discount is more with an indemnity or a fixed benefit plan. But yes, you could, in theory, get that added after the fact if we could prove coverage through broker support. Good question. So you guys put in an income in here, and it's going to estimate a subsidy out for you for this person, right? And so we're going to see, guys, one of my favorite things in here is you're going to be able to see what's the cheapest option that our customer has out there to them, right? What is the cheapest option that if my customer was running quotes on healthcare.gov, what are they seeing, right? Put the power of the consumer right in your hands. So that is what we get right here. You guys can see the plans. It's organized by carrier. So this is Aetna here. You'll see Oscar right here. And so this is going to be in the quoting platform for open enrollment for you guys, okay? For open enrollment. I'm in the Allstate admin test portal, so you guys are seeing this ahead of time. Don't worry. You guys are getting to see this early, but I do get to show it off to you and flex you guys what's coming, okay? So Aetna's in there, whatever, and you name the carriers, right? We're linked with Health Sherpa in the system, okay? So if you guys need to see the brochures, anything like that, you can click those right here in the system. But the really easy thing, guys, what's the out-of-pocket maximum, right? What's the deductible? What's the out-of-pocket maximum? I can quickly and easily speak for my customers on where are the holes that I need to fill with these plans. If you guys want to do the show filters here up at the top, okay, so if we click show filters, you could filter by bronze, by gold, by silver, right? So we can really get in there and dial it in. The silver obviously will come into play depending on the customer's income level. They might be getting a cost share reduction by going into the silver level plans only. This one I don't believe does based on their income, but you guys can filter it out like that, okay? So very important stuff. This is going to be in the quoting platform for open enrollment for you guys. Okay, for open enrollment for you guys. I'm showing this to you early. Okay, I'm showing this to you guys early. So if you guys wanted to add to the shopping cart, let me just go pick an example. I'll pick the cheapest bronze plan available to my customer with subsidy is going to be about $200 a month. Okay. So we could apply right here in the shopping cart, and this would take us through a Health Sharp application. I'll show you what that looks like. I have some slides built out for that. Okay. But if you guys wanted to add supplements to this sale, okay, you just come right into the dental tab. What if you wanted to add the copay 2 dental plan that has unlimited annual maximum, right? For another $50 a month. You can add that in here. What if this customer's not really concerned about all the bells and whistles of a dental plan? Look, he just goes in for his annual checkup. Okay, we can add him a value plan for $20 a month, right? Right here in the same shopping cart. Does he need vision? Does he need glasses or anything like that? Vision level 1, vision level 2, pretty simple stuff. The more expensive one, vision level 2, will allow them to get new glasses or contacts every year. Level 1 would allow them to get new glasses or contacts every other year. Okay, so that's how that works. I'm going to just click don't add any riders right now. We got it. So look, guys, got the supplemental plan in the shopping cart with your Obamacare plan. If we wanted to come in here and add an accident plan, look, I got to speak to the deductible, right? $77.50 is his deductible. Why does it not give me the max amount of pocket in that shopping cart? Let me go back here. So individual, his max amount of pocket's $9,100. So on the accident plan, I need a minimum of $9,100. Well, what do you know? We got a plan in here for $9,200, right? $635 just for the accident, but I'm going to add some cancer, heart, stroke. I'm also going to add some sickness hospitalization in here just so that we can really get some robust benefits. It's affordable stuff, 20 more bucks. So for $26 a month, and then another 16, because look, we got a dental discount now for combining those. For another 16 there, we got dental. So for $42 extra a month, I have protected Mike. I've given him the cheapest Obamacare plan that's available to him there. And instead of suggesting that he moves up to a gold plan, right, for another $100 a month, for $40 a month, I'm able to protect you all of your out-of-pocket exposure on that Obamacare plan, that $9,100 out-of-pocket exposure. I'm able to protect you for accidents, for cancer, heart, stroke, and heaven forbid you're hospitalized for any sickness like COVID or anything like that. We'd also be able to get you protected all the way up to your deductible. All that for $238, where guys, they're not able to buy bronze plans for that cheap, right? And we were able to get the cheapest plan. Don't worry, all health insurance plans suck to some extent. Let me put some supplements in place to make that plan suck a little bit less, right? And so this is going to be an example of what you guys can quickly and easily build out for your clients. And look, we gave them dental, we gave them accident, we gave them cancer, heart, stroke. We protected this 40-year-old individual for a pretty affordable price monthly there, right? This is what we do for our job. And now when this customer goes out and uses his health insurance next year, he's going to sing your praises. You're going to be getting referrals out the yin yang because this is how health insurance was intended to work. All right. If the customer has a little bit more budget available, or the customer maybe is healthier with too much budget and is not going to get a subsidy, right? Maybe I'll edit the answers, and maybe this is a customer that makes 150 grand a year, right? So this person's not going to be getting a subsidy, or shouldn't. Yeah, there you go. Is not going to be getting a subsidy. Now the cheapest bronze plan is 361, and shoot, you want to barely upgrade that at all, we're at $400 a month, right? This customer might be looking for an alternative to Obamacare. And so you might go into the fixed benefit, the indemnity, and you might look at the access plans. Guys, look at these core and these plus. These are brand new plans that just rolled out at the end of September here, intentionally put in here for open enrollment. So if you sign somebody up for one of these plans during open enrollment, there's a 10% discount on it on top of these already adjusted prices. Okay. So the prices have already been adjusted, these plans rebuilt out, but a 10% discount if you sign them up during open enrollment. So really, really good alternative to Obamacare. You see, this is 361 for the cheapest bronze. What if I build you out a plan for 220 and I can even offer you a 10% discount on that during open enrollment so we can get you under $200 a month as an alternative. So half the price to Obamacare as an alternative plan. And look, we would still build out the supplements, right? Still give you the dental, still give you the accident, the cancer, heart, stroke, the sickness, hospitalization. But guys, maybe if we're doing this bundle, right? Maybe if we're doing the core plan for 220, I'm not going to do the rider right now, but we can talk about the specified care rider. This is putting a stop loss in there. So especially if this is an alternative to Obamacare, right? If we are writing this plan as an alternative to Obamacare, this customer makes too much money and dang it, he does not want to pay $400 a month for health insurance. Well, we can write it for $200 a month. And then we can put for another $55 a month, we can put a $75,000 stop loss there. So heaven forbid he gets cancer, has something serious happen. His out-of-pocket is protected. It's stopped since he's not on an Obamacare plan. We are still coming in. Look at that, down to 185. Still coming in cheaper than the cheapest bronze Obamacare plan with all of these supplements, right? $303 a month for a dental plan, accident, cancer, heart, stroke, sickness, hospitalization, a core health plan, access plan with a stop loss of 75,000 there with the specified care rider. All that in there as an alternative health plan to the cheapest bronze Obamacare plan at 361. That's something to look at for you guys, right? So this is what we're going to be doing this open enrollment. That's what having this quoting platform with everything in one place, that's what makes this so important for you guys, okay? Is being able to just play around in the shopping cart right over here on the right. See what this stuff costs, right? See what this stuff looks like, what this stuff costs, and build out the right packages for your clients here, okay? That's what we're going to be doing this open enrollment in all states quoting platform with Health Sherpa partnered with us here. For those of you that have been running quotes and not seeing this stuff as well, this might just be, it might be because of the date that you're running. Yeah, what's up, Dan?
Can you go back to the PowerPoint and go to slide 12 and 13 for me?
I might have deleted them, but we'll see. This is my next one. Is this where what slide 12 and 13?
If you did, I will pop it up and I can show them.
Yeah, I can stop sharing because I might have deleted the whole beginning because I was just going to show it live.
Yeah, give me 1 second, dude. So we got a couple questions on where do I go? Why isn't it in my quoting platform? So to get to it, and for everybody, this has been saved. If you're a part of HST, I know it's in LeadMaster with HCP. I know we've emailed it out. But first, you go to the Health Sherpa white labeled site, right? So you see this on there. When you go there, you're going to enter your email address and password. Now, everybody, we do have access to this right now. You just have to have agent one plus your email address. So when you're first time logging in, click forgot your password and then click on sign in. Now, if, again, you're an HST agent, it's in LeadMaster, so you can just type in like health strip and it should pop up. There's a PowerPoint. I want to say it's going to be like slide 9 in it, somewhere around there.
I'll hold you
So
to that.
go, what?
I'll hold you to that. No.
Hey, honestly, it's like, no, I'm a little rusty today. I'm in the middle of a hurricane. So you go here, go to this part. Then go to your ABO, your normal agent back office, right? So go there, log in, walk through the two-factor authentication for your ABO.
That's why I pulled this stuff out. I was like, I don't want to go through all this. I'll show them a quote.
So you're going to go through quote and enroll, right? Just like Nick was showing me, we've walked through that part. So, but to set it up in the beginning, I'm going to go back a couple slides. The most important thing is this part. You need to go through and set this part up, right? And so once you get into that, it'll sit in the background for you, right? And then it will work together a little better. At the very end, there's one thing that you'll get your own private white labeled site, but that is still going through CMS right now. So that you won't have access to as of today, but that should be up and running before open enrollment. So just one of those things I want to throw it out there. You can walk through the applications like normal, then it's going to walk you through both the ACA and then it's going to walk you through the supplemental application. So I jump in.
Thank God for Dan. Thank God for this man. I deleted like 6 slides because they were talking about the two-factor authentication and agent back office. And I was like, I'm going to be in the quoting platform all cocky and forgot a pretty important slide there. So thank you, Dan.
For sure, for sure. I will quit sharing and you can keep running, my friend.
Thank you, sir. All right. So now the part that I have slides for that I'm going to jump into is the actual enrollment piece. Okay. So I'm not going to do a live enrollment for you guys, but we did a test one and built out some slides on that. So if you guys run through in a Health Sherpa enrollment in the platform, you actually click apply. I'll pull back up the quote that I had real fast to show you guys something. So if you guys notice on the right side over here in the shopping cart, see it as total monthly payment of $664. It is combined the Obamacare plan and the supplemental plans, but you notice how it really kind of beautifully separates supplemental plans in its own box and then the Obamacare in its own box. Well, when we go down to apply down here, it is going to break them into 2 separate applications. Okay. And so that's the process. I'm going to take you through some slides so that you see. Okay. I would be remiss if I didn't say this new Metal Gap plan, guys. This is brand new. You see the cost on it. This was intentionally made to be paired with Obamacare plans. Okay. So price point, this would be good to pair with the bronze Obamacare plan, especially if they get a subsidy. If they're not getting a subsidy, you're going to want to go to the core or plus as the alternative to Obamacare, right? Cool. So let's assume we've got these 2 things built out in the shopping cart with 2 separate plans in here, right? We're going to click apply and then we're going to get into my slide deck. All right. So first thing it's going to do is it's going to have you search the marketplace for this customer to see if they've already been in there starting an application. If no results are found trying to search for that customer in the marketplace, you'll be able to create a new application. So that's all standard marketplace stuff. We're just doing it in this quoting platform now with the power of Health Sherpa backing us, right? So this is your signing off on the consent for the customers. Remember, CMS requires this now. So you'll choose how you have the consent. If you already have it, you can check that box and just move on. And then we're going to be in the application here, right? Who's applying for coverage? Are they eligible for cost savings? Anything like that. We're going to see if we can get them any subsidies, all of that fun stuff, okay? This will be a summary verifying everything. You can see all the check boxes on the left side there. Hey, we're doing big things over here for the plan year. Verify everything's correct. Again, is this renewal of eligibility or a brand new one? The tax attestation, just making sure that they know that this subsidy is not free. Nothing's free in this world, right? Um, and then sign and submit. And this will be a couple different ways that they can do this, the sign and submit thing. And then your customer will sign off on it or give you permission to sign off on it, submit the application. You can download the eligibility letter if you need. You can review the plan, anything like that. Okay. Once we've confirmed everything is correct, you can enroll in the plan or they can make a change to the plan that they have selected, that you have selected, right? So that is built essentially all the first stuff is your normal first stuff in healthcare.gov, right? Building the customer out for this application. Now it's, hey, is this the plan that we really wanted, that we chose over here? Is this really it? Cool. Select that. And then look at the top right, guys. See this return to Allstate? That's the important button that you can't miss, okay? Because at this end part here, you see it says, congratulations, you've enrolled in the marketplace coverage. You're Allstate. But this is actually in Health Sherpa right now. We've got you over in Health Sherpa. It just looks and feels like the Allstate application. And so don't go to dashboard. Don't click get out of there, right? What we need you to do now is return to Allstate. And what that's going to do is that's going to put you back in our shopping cart, checking off that you just did this Obamacare application. So we know that there's an Obamacare sale, a major medical sale in the shopping cart confirmed now, so that now any other applicable discounts can kick into the supplemental enrollments. And so now you'll jump right into the supplemental enrollments. It'll say, okay, if you had a dental plan in the shopping cart, or if you had any other plans in the shopping cart, are we working through that? And then this would be your normal Allstate enrollment for you guys, right? So this will feel exactly like any Allstate enrollment feels. Get their information, who they are, their billing, and then get them again to sign off at the end. You've got our few different ways that we can do that, right? Text pin, an email pin, or just email signing, whatever that might be. Get everything done. And so that is how we are going to combine supplements and Obamacare in Health Sherpa, all in one application, this open enrollment for you guys. It's really going to make you guys pretty powerful. Going to make it a lot quicker at getting things done, I assure you, right? You guys are going to have a lot more power at your fingertips, really running in one quoting platform there, really helping to make sure, okay, which route should I go with this customer? And then you can kind of tinker and play with the different plans and supplements as well. Okay. I'm going to leave this open, and I do see there are some questions, so I'll jump into these and I'll get back into the quoting platform a tiny bit as well. But if other questions come up after the fact, anything about the quoting platform, you can always hit up ngtraining@ngic.com. We'd be more than happy to help there. Let me see. So, yeah, if they're going to qualify for a cost share reduction or anything like that, guys, that is going to be all done based off of their income. Okay. So, that's just something all you're doing is editing the answers here. Or if you haven't already had the answers in there, as soon as you run in and do a quote, all that's based off of the household size and income, right? When you do that, it'll determine if they qualify for a subsidy or anything like that. Okay. Um, is that $7,500 stop loss annual or per incident on the specified care? So talking about the indemnity plan, specified care rider, this stop loss here is per incident. Okay, so $75,000 stop loss per incident, which is pretty cool. But it is capped at like 250,000 per incident, and then you have to it's one incident per year. There's a 90-day entry into that and then a 270-day exit out of it. 90 and 270 combined is 1 year. So the simplest way to remember, it's 1 year per incident essentially. But yeah, it's an episodic deductible there. Good question there. If you already use HealthSure but just create a second account, this will be linked to the Allstate account. Specifically, it's doing your Allstate linkage. I don't know if you can link your existing Health Sherpa or not, but I believe it'll link by your NPN, so I'd imagine it would. Um, what's the difference between expanded bronze and bronze? Marcy, that's a better question for the carriers as they all come on and start talking about their plans. Are you able to add providers and RX on Allstate's platform? No, we're not able to add anything into Allstate's platform. Members can self-enroll with supplements added on the plan without our assistance unless needed. Latanya, what I would say on that is that's not the route I would prefer to go. Most of us, think about just when we all had group insurance through our work, right? We all had all the other supplemental products offered to us through our employers, right? All of us had a cancer plan on there, an accident plan on there, a long-term care plan on there. How many of us ever selected them? We got a health plan and then maybe a dental vision, right? So without our expertise and guidance as the health insurance professional, I don't think they're going to choose too many of those supplements on their own. So I would prefer to help them on my own, personally. What was the training website? I'll need you to go a little bit deeper into that question, Viola. I'm not certain what the training website that we're referencing was. Yeah, supplemental plans, guys. So Marcy asked, can someone just buy supplemental plans, even if they have like another plan with another carrier? Guys, supplemental plans are amazing. Even just down to an accident plan. Any supplemental plan that you see could be sold as a standalone, or it can be sold paired with another plan. And guys, it's one of my favorite things about being a health insurance professional. Everything's a puzzle piece with every customer. It's really helping them understand cost versus risk. How much risk are they willing to take on to save on costs, right? That's what it comes down to. And look, at the end of the day, what if, check this out, guys. What if this customer, this 40-year-old man here, right? And we all know some 40-year-old males in our life. We're all invincible, and I'm not going to the doctor anytime soon. Just ask my wife, right? What if I didn't want to pay that much for health insurance, but I just needed something there? I'm going to decide the best health insurance for me, for Nick, is $17,500 of accident coverage. And I'll add some cancer, heart, stroke, and some sickness on there just in case I get COVID. I'm going to say the best health coverage for Nick is $35 a month plus 10. So $45 a month. That is all the health insurance Nick wants. I can decide that. I can literally make that decision. And you guys could sell nothing but $17,500 of plan enhancer to me. That could be my only insurance that I walk away with. Now, hopefully you guys, as a really amazing health insurance professional, explain to Nick that, okay, Nick, that means you only have a bank account of 17,000 for any medical issues that happen, right? So like if you get cancer, Nick, and those bills are 200,000, so we're just hoping you don't get cancer, right? We're just hoping you just fall and break a bone. And if you fall and break a bone, we should have enough in here at 17.5, right? But that's for Nick to decide. $45 a month feels great for me based on the risk because I'm not going to the doctor this year, right? So yeah, any of these plans that we talk about, they work much better as supplements paired with another type of plan. But guys, they can be sold as somebody's primary insurance if that person is comfortable with that cost versus that amount of risk that they're going to take on. Okay. Viola, NGAH training at NGIC.com is an email. It's an email. It's this right here. NGAH training at NGIC.com. That is our email if you guys ever need to hit us up with some secondary questions after the fact. A really good website where you can go to get more training resources is allstatehealth.com. Allstatehealth.com is an amazing, amazing website for you guys to bookmark. You can go to agents and brokers up here, and it's got things like marketing materials, brochures. The agent tools and information can get you to our YouTube page with different trainings and things like that. So that might be a really good use for you there. Allstatehealth.com. There is absolutely an age limit on SUP plans, Marcy. Yes. Do all state plans just pay a cash value for their accident, heart, and stroke plans, or do so it just depends. So an accident plan is going to pay the medical bills. It's going to pay up to the benefit amount, but the medical bills. A cancer, heart, stroke, or critical illness plan or a sickness hospitalization, those pay a lump sum payment. So if you get cancer, you just get a lump sum check in the mail. It's not based off the medical bills, whereas accidents are based off the medical bills. So it just works differently on all those plans. Just depends how that particular piece of insurance works. Okay. So that is just kind of understanding Allstate, understanding where we're going to partner with you guys this open enrollment with all of these great ACA carriers. Just make sure your customers understand where their risk is, right? The deductible here, the out of pocket, where is the risk and exposure? And let's help limit that a little bit with some of these great supplements that we have here. That is what we're trying to do in what we do here in our job. Okay. A couple slides to finish you guys off, and then I'll give you about a 10-minute breather before we introduce our next carrier. Okay. Big thing. You guys can use a whole lot of different areas to enroll, right? Healthcare.gov. You can go through the state exchanges in specific, like California, it's covered California where I live, right? Or you can go carrier direct. My suggestion is, hey, if you're already going to be adding some Allstate supplements to the sales, why not just use the Health Sherpa linkage in there? Save yourself a login every day, right? I'm loving that. Viola asked, I'm having issues creating a Health Sherpa account with Allstate. Is there somewhere I can call for help? Please call broker support. Allstate's broker support would definitely help you with that. Absolutely. And I can find that number for you if you need it. Subsidies are available for on exchange, right? So you type in the income, that'll help us figure out whether or not this customer may or may not qualify for a subsidy. But guys, that's one of the beautiful things about Allstate's linkage with Health Sherpa now. If they get a subsidy, now we can run really good examples of comparisons of do they need a fixed benefit plan or do they need an Obamacare with other supplements? Okay.
Hey, Nick.
No. So some of the specific state exchanges that are not linked with Health Sherpa and things like that, those will just be separate, unfortunately. But some of those separate state exchanges, like Stefan, you're talking cover California. We both live in California. California doesn't have a lot of great supplements anyway, right? Let's call it what it is. It's one of those things where half of what Allstate's product library is turned off in California anyway. But yeah, that won't be linked. No.
And it's
For
slide 14 for
re-enrollments,
Viola.
guys, what's up?
Slide 14 for Viola. That has the phone number on it.
So it's
Oh,
it's 888-376-3300.
I believe so, yeah.
Let me type it in. 888
I got it.
376-3300, right? I think
You
that's
got it.
I believe that's it off the top of my head, but I confuse those numbers sometimes. That's broker support, guys, with Allstate. Really great team. They can kind of help you get your feet under you going with anything Allstate. Make sure we can get all the quoting platform, everything working for you guys. Thank you for having my back on that, Dan, as well. So yeah, re-enrollments are a lot simpler, guys, but use re-enrollments as a tool in your tool belt to help get some of these supplements in there, right? Hey, how did you like the health plan that you've been on? They say they loved it. Awesome. Well, what if they're on a gold plan? Hey, man, maybe make a suggestion to you. I could save you a couple bucks a month and probably put a better plan together for you if we drop that to a bronze and add some supplements in there. And so make sure you're playing around with our different supplements. The last thing I'm going to show you, because I forgot to, and this is like a no-brainer thing, in the quoting platform, I guess I got to get back in there real fast. I closed it. Guys, every single product that we offer at Allstate in our quoting platform here, we put the brochure right in front of your face. So if it's something you guys haven't sold a lot of, right? You're newer here, maybe you haven't sold a lot and you're just trying to get comfortable with the products that we have, right? When you're in your quoting, if I'm running a quote, look, at the top of every product, right over here on the right side, download brochure. You come down to this next product, download brochure, right? If I'm running the indemnity plans, the very top, download brochure, okay? If you guys click add and it adds a writer, download brochure if you guys want to learn a little bit about the writer, right? So we try to make this thing stupid simple for everyone here, right? And put the power right in your guys' fingertips so you guys can play around, tinker in the system a little bit, get yourself familiarized with it, so that you can really help your clients. Okay. Awesome. I'm going to shut the heck up for about 10 minutes here, a little less than that, as we're going to segue and get ready for HCSC coming on in a little bit here. So thank you guys for letting me kick that off. We'll go on about an 8-minute breather here, and then we'll introduce our first ACA carrier to kick us off. ACA University, we could argue 2024, but it's for 2025 plans. Okay. We'll see you guys back in, let's call it 8 minutes, and we'll intro our next carrier. Okay. Thanks for the opening, guys.
Of course, we'll be covering our 2025 open enrollment period and updates that are correspond with open enrollment. And of course, my goal is to ensure you're equipped with everything you need to guide your clients successfully through this season. Now, there we go. Okay, success. Slide 2. Okay. So just to give you a brief overview, the training focuses on ACA products offered in Illinois, Montana, New Mexico, Oklahoma, and Texas. And again, I'm in Tulsa, Oklahoma, and it's important to note that the content is current as of today. So just be mindful, as always, of regulations and changes that can happen. And we'll, of course, ensure you that we will keep you informed as those updates roll in. So now let's go ahead and get started with what's new for 2025. We have several updates to our product offering across the states. Some of the changes you'll see include enhancements to plan designs, provider networks, and the pharmacy benefits. And we've also made improvements to the member experience, which I'll walk you through in detail so you can feel confident answering any questions that come up during open enrollment. First things first, why choose us? Blue Cross Blue Shield, of course, we're one of the most recognized and trusted brands in the industry. And our reputation, we try to build that on providing high quality, affordable health care coverage. And we're well known for paying claims and being reliable in that sense. And so we think that's something you can leverage when you're selling our products to your clients. We also have the infrastructure, expertise, and people to adapt to the ever-changing healthcare landscape. So whether it's plan design, competition analysis, or regulatory compliance, we're constantly challenging ourselves to be ready. We have to meet those demands, of course. And so that's something you all can rely on as salespeople, so that your clients have a smooth experience, and in turn, you have a smooth experience going forward. HDHP and HSA, healthcare services, HSA, health savings accounts. For 2025, we're adjusting not we, but the government has adjusted the out-of-pocket maximums and HSA contribution limits. This is nothing new. We do go through this every year, of course. So you'll see in 2024, the out-of-pocket max was $9,450. Now in 2025, it's actually going to be $9,200. And family coverage is just going from 18,900 to, and I actually can't see that, 18,400. And I won't go through all of these. You have some updates on the cost sharing levels as well. And then the minimum deductible individual 1,600 to 1,650, and the family coverage will go from 3,200 to 3,300. And the HSA, what the members can contribute to their HSA accounts, going from 4,150 to 4,300 on individual, and 8,300 to 8,550. Okay. So standardized plans, I'm sure you guys are familiar with standardized plans. So the government requires our insurers to offer a minimum number of standardized plans for each network in each area. And we're also limited on what we can offer outside of those standardized plans. So these plans offer pre-deductible coverage on a variety of services, and they offer co-pays instead of co-insurances and single-tier provider networks. We're also limited to offering 2 standardized plan options per network type and meta level. So you'll want to pay attention to how these standardized plans fit into your overall strategy. These are pretty popular because of their simplification. I think I'm getting ahead here. Okay, standardized plans, 4-tier drug plans. So we're continuing to offer both 4-tier and 6-tier drug plans, with standardized plans following the CMS 4-tier structure. The good news is that regardless of the number of tiers, all of our qualified health plans have the same drugs in their formularies, so you'll be working with consistent coverage across the board. So New Mexico, we're highlighting New Mexico because they're not on the federal marketplace. So the New Mexico Office of the Superintendent of Insurance requires every qualified health plan issuer to offer standardized plans, of course. And all the carriers on the marketplace will offer standardized plans on each turquoise, silver, and gold metallic level. And so each plan must have the same actuarial value and maximum out-of-pockets. So these are just our standardized plans in New Mexico. And I will give you a link to our, it's a microsite that we offer, and it has every state and every plan detail outlines of coverage. So you'll be able to study the plans on your own time. I think if I went through every state and every plan, we'd be here all day long. So just want to go over the highlights with you all to save time. And of course, I'm happy to answer questions as you have them. We'll have a Q&A at the end if we have time for that. So again, continuing New Mexico standardized plans. One of the key updates for the preferred pharmacy network is across all our states, we're partnering with pharmacies like Walgreens, Walmart, and Sam's Club to ensure your clients get their prescription easily and affordably. So it's important to remind clients that using an out-of-network pharmacy, of course, will result in higher out-of-pocket costs. So be sure to mention that on your sales calls. Okay. So here's an overview of our networks in the various states. Illinois, you have four networks, one PPO, two HMOs, and a point of service. Montana, you have a PPO and a point of service. In New Mexico, we have an HMO. Oklahoma, we have two PPOs and one HMO. The HMO is in its third year. That's beginning in 2025. So that network in Oklahoma we're selling around 50% of our plans are that HMO plan. The Blue Advantage is around 50% of our sales. Blue Preferred, not as much. It used to be our number one network, but it's more expensive. And the Blue Advantage PPO is almost as comprehensive as the Blue Preferred. So the Blue Preferred over time will probably price itself out of the market on the individual side. And then Blue Cross Blue Shield of Texas, we have two HMOs we offer. One thing I want to highlight is in every state we offer statewide coverage. So it's in all of the counties in these states that we have plans available. Now, for example, in Oklahoma, we don't have our HMO in every single county, but we are offering coverage in every single county in all 5 of our states. So these are just some updates going into 2025. In Illinois, the point of service network is new. In all states, we're offering Blue Points. So that's something that through activities, members can receive rewards. And we are offering for the first time a $100 reward in 2025. And we'll have more details on that as well. Illinois, Montana, New Mexico, and Oklahoma. We have something called a mental health hub. This is new to me as well. But it's a virtual one-stop shop for all mental health resources. Has the ability to contract out to a wide array of mental health vendors. So you may have different specialties in that sphere of mental health. And so we have different contracts available with third-party entities that can provide services in those various forms. As I mentioned earlier, just a few more details on the network information, what providers we offer in that realm. So I won't read all of these off, but you can see that Walgreens, Walmart, and Sam's Club are a consistent among the states, across the states. And continuing with prescription network information. Member out-of-pocket costs are higher with out-of-network pharmacies, of course. There is a 50% penalty which applies for plans that allow out-of-network benefits. And if members fill prescriptions at out-of-network pharmacies, they may pay full amount. Then they can submit claims for eligible reimbursement if applicable. What are our 90-day supply options? For ordering a 90-day supply of medications, you'll use our preferred value network. You can also use mail order via Express Scripts. There's additional mail order pharmacy options in Montana, which is called Ridgeway Pharmacy, and then additional mail order pharmacy options in Illinois, and that's Walgreens Mail Service. Okay, so we talked about New Mexico with the standardized plans. So these are Tier 4 and Tier 5. Tier 4, we offer Illinois, Montana, Oklahoma, and Texas. That's going to be those standardized plans. Tier 5 in New Mexico, or 5 tiers rather, in New Mexico. Generic, preferred brand, non-preferred brand, preferred specialty, non-preferred specialty. And then on our plans that are custom, 6-tier drug network. And the addition here would be non-preferred generic. So dental and vision. Okay. So we are expanding our dental and vision offerings. For dental, we now offer coverage for preventative services, oral surgery, and restorative work with plans that fit multiple budgets. And for vision, excuse me, we offer coverage for yearly exams, frames, lenses, and other services for dependents up to age 19. Both of these add-ons can be a great way to increase the value of the plans you're offering to your clients. Here's a more detailed look at the dental coverages. So we offer two plans, 1A and 1B. Well, and actually, we've added 1C as well. So the A plan is going to be your more expensive plan. It's more comprehensive. So A and B both offer 100% coverage for most preventative services. And then you'll see the maximum benefit for A, 1A is $1,500. Maximum benefit for B is $1,000. And then C is, of course, the lower cost premium. And it's 80% coverage on most preventative services. You have a $50 deductible for in-network services. And then savings on all dental procedures up to an annual $1,000 max for adults. And then we have Blue Care Dental 1D. This is the lowest monthly premium. 100% coverage on most preventative services provided by in-network dentists. So it's a step up compared to the C. $50 deductible for many services, but the savings on procedures up to the annual $1,000 max for adults. And again, this is a dental slide, more details on the coinsurance amounts for the various benefits. And again, you'll be able to see this information in the microsite I referred earlier that has all of our plan designs among many other pieces of information. One of the big changes this year, or actually it happened in 2024, is we do not offer waiting period credit. There is a 12-month waiting period from the date of purchase. And so just be aware of that. On some of the services, there's also a 6-month waiting period on some of the other some services as well. And I guess, okay, so we have a slide on this. So current members, we will waive the wait for current Blue Cross members, we will waive the waiting period only if members meet their previous waiting period. So if they were on a dental plan for 6 months, that unfortunately will not count towards next year's 12 months. They will have had to satisfy it. All right, pediatric vision plan offers coverage for yearly comprehensive vision exam at $0 copay, provides vision benefits for dependents up to age 19. And the plan also offers coverage for other vision services and materials, including retinal imaging, contact lens fit, and follow-up frames, lenses, and more. And of course, the pediatric vision is embedded into the medical coverage. Okay, so qualified health plan vision highlights $0 copay for eye exam with dilation, $39 for benefit for retinal imaging, $150 allowance for frames with 20% off balance over $150, $0 copay for some lenses, single bifocal, trifocal, or lenticular, Other progressive lenses have varying copay, $0 copay for medically necessary contact lenses, and benefit frequency is once every 12 months. Okay, value-added benefits. I had, referenced one of them with the $100 gift card that we're offering this year. So, our purpose behind these benefits are so that members are encouraged to live healthy lifestyles and maintain good health. So, Well on Target is one example where we offer rewards for meeting goals. One of the way to get points is to simply take a health assessment, which is probably the easiest thing a member can do. And so they will get points which do correspond to things like gift cards that have dollar values to them. As you can see, we offer a lot of value-added benefits. So Well on Target, I discussed Blue Points is a part of that. And like I said, they can earn up to a $100 gift card this calendar year in 2025. 24/7 nurse line. I think all carriers have a nurse line, but I do want to highlight that because one thing that our PPO plans had previously, and we may have a slide on this, not 100% on that, but we offered the Blue Card benefit, and we've had some waste, fraud, and abuse in that with that benefit, and so we are no longer going to offer the Blue Card benefit. And for those of you that don't know what that is, the Blue Card benefit allowed members to go outside their home state, and any Blue Cross Blue Shield provider in any network became primary for them, as though they're in their home state and in network. So, for example, someone travels from North Carolina to South Carolina. Once they're in South Carolina, whatever Blue network is available in South Carolina, that becomes their primary network. That's the way Blue Card worked. Now we no longer will offer the Blue Card network on our PPO plans. And so the Nurse Health line will obviously be an important piece to the pie when seeking care. We, of course, will offer emergency care as an in-network benefit. But calling the Nurse Health line will help someone to determine whether or not they have an emergency. Also, in addition to that, another big key to this solution when you're out of state is MD Live. So that's going to give you your virtual visit. So if you have someone that is out of state, they can always utilize the MD Live option, which gives them a virtual visit with either a primary care, dermatologist, urgent care, behavioral health person, or provider, I should say, among other specialists. And that's in all 50 states and Puerto Rico. So we expect to see a lot more utilization of that with the Blue Card benefit being removed. We also offer in-network benefits in contingent counties. So if someone travels to a border county of North Carolina, in Oklahoma, we have several that will go across state because, like on Eastern Oklahoma, we have Fort Smith, we're right across the border. So those individuals that are in that area can go to a border county and still it'll be like they're in state. Learn to Live is another mental health type of benefit. It offers around-the-clock mental health assessments and online cognitive behavioral health therapy. And so that's for your mild to moderate cases. And then the mental health hub I mentioned on the previous slide. Meds Your Way, we're going to skip that for now because that's not applicable just yet. So that's going to be a benefit that will make sure that if there's something outside of our network discounts that is cheaper, it'll automatically apply, but that is not live yet. Blue 365 is a member discount program. Again, that includes healthy living, but it's nothing that you have to earn. It's already there, and they can utilize. There's a website for that. It's part of Blue Access for members, and they can utilize that to get discounts on anything from gym memberships, exercise equipment, to something that if you have perhaps you're going through therapy and you need some kind of equipment to strengthen your wrist or something like that, those types of equipment pieces as well, as one example. All right. Don't think we need to go through all of this. That's more specific information on Blue 365. And virtual visits. Did some talking on this already. Some of the positives, besides what I discussed being out of state, is you're not having to wait for an appointment. That goes for future date waiting, but also you're not waiting in waiting room with other sick people, perhaps picking up something else. So for me personally, I prefer a virtual visit if I can do that for those specific reasons. Of course, wait times for this, they average 22 minutes for a medical visit, and for behavioral health, 5 days. If you compare that to a typical provider visit, it's a huge difference. And you can also do these visits either by phone or video. And again, we always want to highlight the behavioral health because that's not necessarily the first thing people think of when they think of a virtual visit. So that is available. Again, this is another MD Live slide, and it tells you what the rating is for the app. And of course, when people rate an app, they're including the service. So these are very positive ratings, 4.6 out of 5 on Google Play and 4.7 on Apple iStore. All right, virtual visits. See if there's anything here that I haven't already discussed. There are translation services. And again, it's 24/7, 365, medical, behavioral. You can access MD Live through Blue Access for members, but probably the best thing to do is to have the mobile app. And it is integrated with our provider finder, so it's easy to get an in-network provider on that. And if you call either the number on the member's card or the nurse line, we can transfer you to a MD Live professional as well. Mention the nurse health line. Again, that'll be important to determine whether you need to go to the doctor or not, whether something is an emergency or not. I always like to tell people, if you're like, well, I don't have time to call a nurse health line in an emergency, well, that should give you the answer to your question. You probably are in an emergency and should just go ahead and go see the either emergency room or urgent care. Another thing with the nurse health line, we also offer an audio library with more than 300 health topics. And I have not accessed that. I didn't know it existed until a few weeks ago. So if I had firsthand experience, I'd love to tell you about it, but I think that's something interesting to explore. And I've lost sharing status, and I don't know if that's because of PowerPoint.
Oh, you should be able to still do it. Give it a shot.
Honestly, I'm not sure what happened here, but that's telling me that's the last slide. It doesn't have an end slide, so I apologize.
It is. That was
okay. That was
the last slide.
That was a little abrupt, and I apologize for that. But yeah, apparently that's the last slide. So
Are you
I
open for a
appreciate
couple
it.
Q&A there, Zane?
Yeah,
Well, like,
I'm ready. Let's
okay,
give it a
cool. So
shot.
I will start at the top. So it'll be more towards the beginning of your presentation. Chanel Ferris is asking, do clients have the exact same coverage whether they are on or off exchange?
So we offer plans that can differ, but if you're talking about a plan, um, like let's say it's called the Blue Advantage Silver 201, it's going to be the same both on and off exchange. But we do have plans that can vary between the two.
Okay, gotcha. Is the mental health hub included on all the plans?
Yes.
Oh, that was an easy one. Bam, nailed it. Wicked. Um, this one, ooh, it's interesting. Are you offering weight loss for your 2025 plans, like the weight loss drugs?
We are not.
Oh, cool. Very cool. This
Now,
one's,
I
oh, sorry.
realize, obviously, there are drugs that can cause you to lose weight, and a lot of providers are using codes to call it pre-diabetes. And I'm not saying that it's not valid or anything like that, but it's going to be a little bit difficult just to slap that code on there and get it if someone's really trying to get, you know, use it for weight loss.
This is about the My Blue Plus POS in Illinois specifically.
Okay, I may
Uh,
need to write this one down and get back to you.
this one I think you're going to have to, for sure,
All right.
actually. Will the Chicago teaching hospitals be included, including like University of Chicago Rush, Northwestern? If you need to get back to me, that's completely fine. The agent, I love her to death, so I will make sure she gets the information.
Yeah, that's something we could look at on the provider finder, I'm sure.
Mm-hmm.
But it could be something that it won't be added until 2025. And I'm not saying that based on anything I know. I'm just saying that it wouldn't even really, for me to take the time and look it up today, it could change for 2025. So I will ask our Illinois representatives that question.
Oh, sounds good. Another Illinois one for you. Does the new Illinois POS plan require referrals?
For specialists,
Sure. Yeah. They didn't put specifics, but let's go with specialists.
okay, I'll get back to you on that one as well.
Not a problem. Oh, yep. Specialist, cool. Yeah, Laura, he'll get back. Not a problem there. Brittany's asking, are there any fertility benefits on these plans?
Um, Fertility benefits. I don't think there are, but I'll find out.
Sounds good. Sounds good. And then for the adult dental you were talking about, is that offered in all states, or you showed the specific states it's available in, correct?
Yeah, I believe it's in all states, all 5 states.
Awesome. Looks like you only have a couple left. You're making it through, man.
Okay.
First off, I'm not sure if this is you or Melissa, but will we get a copy of this presentation? I'm not sure. I don't think you guys did it last year. Did you?
I can,
So go ahead, Melissa.
I was gonna say I can take that one. The deck that Zane went through is not approved to be distributed yet.
Okay.
But once it is approved, we will share it with you.
Awesome.
Once it's approved for distribution, we will share it with you. Yes.
And just to add to that, we will also be uploading our respective, or I should say, we'll upload our decks that go into more detail for each state in our respective states, Blue Cross Blue Shield sites as well. So those are not uploaded yet, but if you want to go into a deeper dive, those decks will have more slides for each state.
Sounds good. It looks like this could potentially be the last question for you. We'll find out. Nope, I lied. There's another one. What types of emergencies are covered out of state? And what about urgent care visits?
So the type of emergency, we really don't pinpoint that. If you think you have an emergency, then you should seek care. But once you're stabilized or told that, it's not life or death, or, the sake of losing a limb or something similar to those things, then at that point, the cost would be out of network. So up to that point, it would be in network because you thought it was an emergency. But once you find out it's not, then that's when it would start to cost you out of network costs. Now, that's why I say, if you're unsure, then it's best to go ahead and call the number on your card or the nurse health line and find out. But if it's, again, obviously a situation where it's like, I can't, well, that's an emergency. So seek emergency care.
Perfect. This one's about the pediatric dental for you. Does it require
wait a second. I missed a question. You had a second part to that one.
Was there? Oh, shoot. Let me double check. See if I can find the question. There's a lot there.
I think it was virtual care or something.
Urgent care. Sorry, urgent care.
So urgent care would be covered if, but the same rules apply.
Perfect. Pediatric dental here. Does it require that the dentist to be in network, and does the medical deductible need to be met first?
So on some benefits, the medical deductible does not have to be. Did you say medical deductible?
Medical. Yep, medical deductible.
No. Okay, no, the medical deductible does not have to be met first, but there is a dental deductible for some benefits. And then, again, I missed the first part.
Does the dentist have to be in network?
It does.
Perfect.
Yeah.
Perfect. Peter's asking about Zepbound, which is a insulin shot for both diabetes as well as weight loss. Wondering if that is covered.
I don't know off the top of my head, but I will put some resources in your hands that you can share with your producers and everyone on this call, which will include where to go to find if a drug is covered. And what I mentioned earlier, we have a readiness microsite that has more than you could ever absorb on it.
Good. I can't wait to get that, guys. When we get that, we will make sure that's distributed properly. I know every year, you guys are really, really great at getting us the resources. We upload them every year. So there's tons of resources available. And then, of course, when the PowerPoint is approved, we'll make sure that goes in the right hands. And then Zane, as you're saying, like there's state-specific ones that get into some really great detail out there. So,
Yeah.
So keep in mind.
And I have a question for you. When you guys sell, do you use the provider finder on the enrollment site, or do you want me to offer up our provider finders as well?
We use it on the enrollment site, but everybody here is going to work a little different. So if you could provide the additional resource, we'll make sure it gets out there. Absolutely no question.
For sure. We'll do it.
But you made it, man. You ran the gauntlet. You got through all the questions. You're on the other side. It probably feels good, right?
Yeah. Well, I've got a few more questions to answer, but I'm impressed at that there's not 30 more questions. So
just take it on a compliment, right?
Pretty on the ball. Nice.
So you'll get over the microsite, right? Or is that in the back office, or do you know?
What did you ask?
The microsite. Do you know if that's in the back office, or is that going to be something separate that you'll be able to send over?
I'll send that over. Yeah.
Okay. Sounds good. Well, Zane, I really want to thank you for your time today. Like from us here at HST and HCP, like we appreciate you willing to jump on here and just get hammered with questions and present the material. Like it's a lot, but thank you.
Well, I want to thank you all for, you guys have a very respectable book of business with us. I want to thank you for that. And I for sure acknowledge that. And, I appreciate you allowing me the time to present to you guys. I appreciate your interest in our products. So it's my pleasure. So thank you very much.
Well, perfect, Zane. So when he gets the resources over, him or Melissa, I will make sure it gets out there, everybody. Now, keep in mind, this is the end of the day. This is the ending of day one of ACA University. We will start tomorrow at 10 a.m. CST. So I'll see all you all tomorrow. But Zane, thank you. Melissa, thank you for coming on. I appreciate both of you.
Thank you.
I hope you all have a great day, okay?